Good morning, everyone. Thank you very much for joining this AMS webinar sponsored by the Board on Environment and Health. I'm delighted to introduce three panelists that are going to talk with you about extreme heat, understanding and reducing human health risks. I am Krista Ebi at the University of Washington. Our three panelists are Jane Baldwin, who recently completed her PhD at Princeton University, in part looking at compound heat waves. Jennifer Vanos at Arizona State University, who has been doing critical work on understanding heat, how it affects children, and how it affects occupational stress. And Hunter Jones at NOAA, who is working to lead a number of initiatives, both nationally and internationally, on heat wave early warning systems to increase the resilience of our communities and our citizens to the kind of heat that the eastern U.S. is experiencing right now. And with that, Jane, would you like to start off?
Sure, Chris. All right, hi everyone. Thanks so much for tuning in. As Chris said, my name's Jane Baldwin. I recently finished my PhD at Princeton University. I'm an atmospheric scientist by training, and I'll be starting a postdoc at the Lamont Doherty Earth Observatory at Columbia University in the fall, so look me up there. So the title of my presentation is Temporally Compound Heatwave Events and Global Warming and Emerging Hazard. Basically, what this presentation, what the research project I'm describing looked at were the risk of back-to-back heat waves and how that might change with global warming. This work was recently published in the AGU journal Earth's Future under the title that's the same as that of this presentation. So in case you're interested, please check it out there. So by way of introduction, I want to talk a little bit about how heat waves are typically defined. Now, we need to define heat waves quantitatively for a number of reasons, so we can study the meteorological phenomena associated with them, and also so we can quantitatively relate them to health impacts. Heat waves cause a very significant amount of mortality in the US and other countries each year, among other health impacts, which I'm sure the other speakers will discuss more later. This is a typical temperature time series for a heat wave. This is from the Chicago heat wave in 1995, which is one of the most notorious heat wave events that has occurred in US history. So to define this heat wave quantitatively, we first need to assign a threshold above which days are considered to be extremely hot. Here I'm using a seasonally varying threshold. Some definitions use absolute thresholds that don't change over time. So the heat wave occurs when you have a number of days in a row exceeding this threshold, so a number of consecutive extremely hot days. In short, a heat wave occurs when temperature increases above a threshold and stays above it for a number of days in a row. This is the classic definition of a heat wave and what has been used in many other studies to look at changes in heat wave risk with global warming. Now, if you take the Chicago heat wave from 1995, which exhibits this classic consecutive hot days heat wave structure, and put it in the context of many other heat waves that have been associated with high mortality, you can see that the temporal structure of heat waves actually varies quite a bit. For example, the Belgian heat wave in 1994 exhibits a structure where it's composed of many short duration heat extremes interspersed with cooler breaks. What I'm showing here are the 4 heat waves in the US and the Europe respectively since 1980 that have been associated with some of the highest mortality. So even though all of these heat waves are impactful, they show a wide variety of temporal structures. Our takeaway from this is many impactful heat waves might be better described as compound in time, meaning again composed of either short duration heat extremes or consecutive heat waves. Short duration heat extremes occurring in sequence, I mean. So if you think about this from the impacts or vulnerability perspective, there are a number of reasons why you might expect multiple heat waves occurring in sequence to add together in the impact space to cause greater impacts than the sum of their parts. In other words, to add nonlinearly. The first reason is building thermal inertia. So if you have an initial heat wave, temperature inside buildings where people spend most of their time and live heats up unless it's very well insulated or you have very good AC. So the temperature in the building heats up, and even if outdoor temperature drops, that indoor temperature is going to remain somewhat elevated and take a while to cool off. Another issue is social system inertia. So during very intense heat waves, such as Chicago in 1995 and Paris in 2003, emergency responders, hospitals, morgues, et cetera, were all reached their capacity in terms of the number of people or patients or bodies they could deal with. As a result, their ability to respond to additional people who were suffering was limited. So altogether, because of building thermal inertia and social system inertia, among other reasons, outdoor breaks in heat waves might not imply breaks for mortality. And this suggests that if you have multiple heat waves in a row, their impacts might add together non-linearly. So motivated by what appears to be a historical importance of compound heat waves, we wanted to look at how the hazard of hot days compounded onto prior heat waves will change with global warming. Again, there's been a number of studies looking at how the risk of classical heat waves will change with global warming. And so we're interested in particularly looking at these temporally compound or back-to-back heat waves. And spoiler alert, what we generally found is that in the projected future, a greater proportion of heat wave hazard will come from compound days. So over the rest of this presentation, I'm going to describe how we came to this result, how we understand it, and some important possible implications of this. So to first study heat waves, again, we need to have a specific definition for them. For our compound heat wave definition, we need to assign about 5 different components. The first is we need to choose either daily minimum, maximum, or average temperature data to use, a percentile of the threshold above which days are considered to be extremely hot, a minimum number of hot days that need to occur in a row to initiate a heat wave, a minimum number of hot days that need to occur in a row for a set of hot days to compound onto a prior heat wave, and then a maximum break length, so number of cooler days that can occur and heat waves still compound onto one another. So for the purposes of this presentation, I'm going to primarily show results just for the definition shown in the right-hand side of this table, but I want to note that the qualitative results I'm going to describe are robust to a range of parameter definitions, definition parameters. So we're basically taking the perspective of being somewhat agnostic to the particular impact and looking at a wide suite of possible heat wave definitions and seeing what is consistent across those definitions. So to help give a little more intuition about what this definition means, let's say you have this idealized temperature time series where hot days are demarcated by red H's. According to prior definitions, this would constitute 2 3-day heat waves with one hot day in the middle that really isn't counted in the heat wave count. According to our definition, we're going to count this as a 3-day heat wave plus 4 hot days compounded onto it. So instead, the hot day in the middle is incorporated into our definition. And we're going to count this as basically one longer event. So we're going to be interested in both the total number of compound days, so hot days occurring shortly after prior heat waves, and also the proportion of heat wave risks coming from these compound days versus the total number of heat wave days. So the data that we looked at were a number of different reanalysis data sets that supply daily minimum and maximum temperature data, and also data from global climate model simulations. The global climate model we used was GFDL CM 2.5 FLOR, which has a relatively high resolution atmosphere and land, and a somewhat lower resolution 1-degree ocean. The high resolution atmosphere and land allows us to simulate heat extremes with a fair amount of accuracy compared to other models. So first, we looked at a 30-member ensemble of this global climate model simulating 1941 to 2050 along the RCP 4.5 emission scenario. The purpose of this was to primarily validate that the model was able to simulate historical changes in heat waves with reasonable fidelity. Next, we looked at differences between 2 idealized global climate model simulations. The first simulation is a long 1990 control simulation. So basically in this simulation, we set CO2 levels in the GCM to 1990 levels and keep that consistent for many years. And then the 2 times CO2 simulation, we set CO2 levels to be twice 1990 levels and set that to be consistent for a number of years. I'm going to show results comparing 100 years of daily data from the long control and 2 times CO2 simulation. So basically isolating the impact of an increase in CO2 on the heat wave metrics of interest. And I want to note that I use a threshold calculated from 30 years of the control run and apply it to both the control run and the 2 times CO2 simulation. So what this means is, since we know the 2 times CO2 simulation is warmer than the control simulation, we're definitely going to have more heat wave days in the 2 times CO2 simulation than the control simulation. Where it becomes interesting is to see what proportion of the heat wave risk is coming in the form of these more unusual temporal structures of the compound heat waves versus individual heat waves. Okay, so now finally diving into results. So in the present, or the idealized present climate, represented by the control simulation, we have on average, looking at the summer months, only about 1 hot day compounded onto the heat waves each year. So if you look at this as a proportion of the total number of heat wave days each year, only about 10% of heat wave hazard is coming in the form of compound days in the present climate. So in other words, in the present climate, a quite small proportion of heat wave hazards from compound days, which helps explain why there hasn't been that much attention given to these compound days in the past. Now, if we look at the future hazard from compound days, the picture changes quite a bit. So this is the proportion of heat wave risk from compound days, again, in the control climate, about 10% on average. And this is the proportion of heat wave hazard from compound days in the 2 times CO2 simulation. And in the 2 times CO2 simulation, on average, about 25% of heat wave hazards coming from these compound days. So this is a significant increase, both in the total number of compound days, but more importantly, in the proportion of heat wave risk coming from these compound days. If you look at the difference in between these 2 plots, you can see that this increase is pretty consistently positive across space. And it tends to be greater in the tropics, which is typical of threshold-based heat wave definitions. I'd be happy to talk more about that in the Q&A if people are interested. So in addition to being robust across space, this increase in compound proportion is also robust across definitions. In this figure, the X's plot global means for different variants of our compound heat wave definition. And on the x-axis of this figure, we have the proportion of heat wave risk from compound days in the control climate. On the y-axis is the proportion of heat wave risk from compound days in the 2 times CO2 world. And you can see that in all cases, these x's lie above the 1-to-1 line shown here, demonstrating that in the future climate, a much greater proportion of heat wave risk will come from these compound days. And again, this result is robust across definitions and robust across space. Okay, so we have this pretty clear change in the proportion of compound days, which we were initially surprised by. And so what explains this change? So we did a fair amount of work, which I don't have time to describe in detail, but is in the paper, doing statistical analyses with the global climate model data to try to understand what the source of this change was. And in the end, the explanation is quite simple. So in the present climate, when a heat wave occurs, it's such an extreme event that it has to occur due to a system with some memory associated with it, such as a blocking high pressure system, which allows temperature to gradually build up over a number of days to the point where it exceeds this extreme hot day threshold. However, in the future climate with warming, you can, to first order, think of the present weather being shifted up. The mean has shifted. And as a result, these kind of random noise, typical weather variations are close enough to the threshold that they can start to exceed the threshold and start to generate extremely hot days. And as a result, you basically have many more days with this high variability that can start to generate compound days. So Altogether, to conclude, the proportion of heat wave risk from hot days compounded onto prior heat waves will increase in a warm climate. We find that mean warming and weather, not changes in the weather, drive this effect, which is important because it gives us more confidence that this is a robust effect. Global climate models, we probably have somewhat less confidence in their ability to well simulate changes in weather, but they are well tuned to simulate changes in warming. That's their main purpose, mean warming. Mean shifted observations likely provide a better estimate of future compound proportion than GCM projections. I wasn't able to discuss this that much, but this is an interesting corollary of the fact that it is the mean warming in weather, not changes in weather, that drives this effect. Now, there are a couple of different extensions of this work that would be useful to do. For example, using a combined temperature humidity metric that gets closer to the physiological impacts of heat waves and seeing if these results are robust to that type of heat wave definition. And also doing further work to connect the climate model results to the spatial scale of impacts. We're currently doing some work with urban climate models to do this. However, even as it stands now, I think there are a few important questions this work raises that I'd like to put out to the community to consider further. The first one is, how can the added vulnerability from prior hot days be quantified? So if we have an initial heat wave, how does that affect vulnerability to latter heat waves? I think this is important to consider from a health perspective and also for other heat wave impacts such as agricultural impacts. And second, how should policymakers prepare for this change in the effective temporal structure of heat waves, of having more of these compound heat waves? Do policymakers need to prepare for this change? I think these are both open questions that merit further work. So thank you very much for listening in. And again, if you're interested, you can see this paper in Earth's Future. Thank you.
Thank you very much, Jane. That was really interesting. We'll be taking questions after the three presentations. Jenny, you up next?
All right. Hi, everyone. Thank you for attending our first Board on Environment and Health webinar for the AMS. We're very excited. So as Chris mentioned, my name is Jennifer Vanoss. I'm an assistant professor at Arizona State University, and I work in the School of Sustainability. And I'm also part of the Geography and Urban Planning Department. And today, related to extreme heat and other varying factors that are connected to heat, I'll be talking about children's exposures in urban environments. I largely study the impacts of extreme heat and sun exposure and air pollution within urban. Sorry, I think I'm having speaker problems. Can everyone hear me?
Yes.
Okay, hopefully it doesn't do that again. All right, so I go from thinking small to try and make big impacts in cities. And so looking at children, looking at children's spaces, and really thinking about how these spaces affect children's health and what are the levels of pollution or heat or radiation in these spaces. I asked the question, what could be the cascading impacts? What could be the co-benefits if we reduce these exposures? Are the spaces designed for the given purpose? And of course, I'm often looking at all of these combined exposures at once. And I'm also trying to think about how can we measure these in the given space so that we can scale down and we're not using distant weather stations from airports to make decisions at a very local scale, and trying to work with city planners or teachers or principals to do this. It's important to understand these exposures in outdoor play spaces. We know that children gain a lot of their physical activity in these spaces, and we want them to be able to continue to do so, even in the face of urban warming or climate change. And a lot of the activity that children get is accrued within schools at recesses, and this is an even more important percentage for kids that are low income and may not have after school sports. So I like to think about how can we see these invisible impacts. One of the interesting aspects of a pollution event or an extreme heat event or just of understanding radiation exposure is that it's all invisible to us. So I can show you these two photos right now of Phoenix and ask you which one was a heat wave, which one was actually a cold wave, and you probably wouldn't be able to guess. If you had a really keen eye, the bottom left picture, you could see some snow in the mountains. And so that was definitely cold for Phoenix. But that one on the bottom left also had poor air quality that day, and it's not something you can see. And so same way when a freeway is put next to a playground, which is, sorry, I did it again. So a freeway is next to a playground, that's kind of common. You can't really see that in the same way when you have high surface temperatures in a play space. You can't see that without using something like a thermal camera like that is shown here. And so you can then quickly start to see how hot certain surfaces can get, but without that, you wouldn't know without going to touch. And that's something that we've been studying a lot of in some of these play spaces and trying to understand better ways to measure it, better ways to convey it, and potential alternative options for the use of artificial materials that can get up to 80 degrees Celsius in play spaces and thus burn children. And so, of course, shade can come into play, but there's other new technologies that are being created. So overall, all these elements in a landscape, they're invisible to people, but they can be seen in other ways. And when we share that information with teachers or children or just the general public, they can be seen in a new way. So overall, we know that we can't treat children like they're little adults. They have and we're thinking younger children here, so children generally age 7 or under. And so they have higher surface area to body mass ratio. That means that when it is really hot, they gain more heat from the environment. They haven't developed all their sweat glands yet, so they may not cool as efficiently through sweat, which is the most important mechanism for cooling in really hot situations. And it's why we can live, one of the reasons we can really survive in Phoenix when it's 110 out. There's really no humidity on many of those days. They're closer to those hot surfaces I just showed you, so just their core being closer to that results in them having a higher vulnerability to that heat. They have inexperience in these situations, and so their adaptive behavior in a hot situation would differ. And overall, we don't know too much about how kids are experiencing these environments or the heat because we have very few studies on them. Largely, we can't put 7-year-olds in a heat chamber, so we don't always know their response. That would be unethical. And so we're working to understand more about how they feel, how they think, what they're experiencing in the play spaces that they're already playing. Solar exposures to radiation. So we know that this is directly connected to heat exposure, and we know that we seek shade on hot days. Kids, again, are more sensitive to those. Their skin isn't fully developed. We know that a lot of the adult melanoma cases can be traced back to childhood exposures, and it's really important too that knowing that and then connecting to the fact that skin cancers are the #1 cancer in the US. And then air pollution, so the kids' lungs aren't fully developed and they have a higher breathing rate. And so that's all really important to understand. And I want to clarify or make the point that this isn't a future problem. These issues have always been a problem. It's a now problem. And I think that we can plan for the future, but also making changes now can have a big impact on kids' ability to play, on people's ability to use these outdoor spaces and stay healthier. And not have to go inside. So I don't think the solution is go inside and go into air conditioning. I think the solution is learn to design more appropriately for the given climate. And a lot of my talk is focused on hot environments in the Southwest, such as in California and Arizona. And overall illness or negative effects of these exposures can be completely avoided. So one example study I did in Texas looked at children's thermal sensation, and we asked the kids how they felt, and we also modeled how they felt with various environmental and behavioral inputs, so their activity, so we could measure their heart rate and we could measure the clothing they were wearing, and then we also measured their exposure to solar radiation, so we knew when they were in the sun or shade. On these hot days, they preferentially choose to be in the shade, and we know that their energy budgets, which would be predictive of experiencing heat stress, were significantly lower. What's interesting about this work too is that children often stated that they were hot and that they would prefer to be a little bit cooler, but then they said they were comfortable and wanted to keep playing. And so that's one of the subjective psychological differences you might see between an adult and a child. And then connected to sun protection, when the kids were in the sun, overall conveying this to someone, you can say playing in the sun for a 60-minute period would cause skin damage or sunburn, and we know that because we had the UV dosimeters on their skin. However, playing in the shade for an hour and they had a big shade sail that the kids would play under, there was no skin damage or burn, and we also know they were more thermally comfortable under there. Another study in El Cajon, California, so another pretty warm, dry environment, a lot of sunny skies. We looked again at children's physical activity and the locations that they were playing with GPSs, and then also again their sun exposure, and we monitored the microclimate. And we were able to see where kids preferentially played within the play space and also understand where they're getting the most physical activity. And so overall, we saw that they had higher heart rates when they were playing in the sun. However, they only spent about 90% of their time, or 10% of their time in the sun. They were mostly sitting in the shade, playing under just the one shade tree on a lot of our study days. But when they did go out into the sun, they got more physical activity. So then this might make you think if we provided more shade, maybe they would move more, but that needs to be studied. And of course, this study is only applicable to the one playground and the one climate. So I think there's a lot more that we can do. And then I wanted to quickly bring this back to air pollution and think about what some schools are trying to do globally to decrease pollution exposures to kids in playgrounds. We know that they're elevated, the pollution exposures are elevated next to busy roadways, and we also know that a lot of schools can be placed close to busy roadways, especially if it's low cost land. So some schools are looking towards hedges and trees as barriers to decrease those pollution levels that the kids would experience. So we know that vegetation can help remove gaseous air pollution through uptake through the leaves and remove particulate pollution by intercepting those airborne particulates. And so using those green facades and other barriers to uptake that pollution into their biomass can be really important. But again, we need to think about what's the right plants in the right place. In a lot of cities, we have to be careful not to plant VOC emitting trees because they can cause ozone problems. What's the watering cost? So that's one of the biggest questions here in Phoenix. So how can we plant drought tolerant species? Allergies comes up a lot. And then of course, what provides the best shade? So a quick example, we're working with a school in South Phoenix, which is a low income area that has a lot of high temperatures, very little vegetation, and has the highest air pollution levels generally in Phoenix. It's very low lying within the valley. And this school is, they're renaturalizing all their outdoor play spaces to become outdoor play and learning environments. And they're really focused on, we're working together to decrease exposures to heat and radiation and pollution there and integrate more vegetation into those spaces. So these are some of the mock-ups they might consider. To do so, but we're doing measurements pre and post intervention, design intervention, to see how we can reduce those exposures, where the kids play, and what that would mean for their health. We're also doing some health data collection. And so collecting air pollution exposures, we have 6 of these monitors up within the play spaces to do pre-post measurements of particulate matter, nitrogen dioxide, hopefully ozone soon. And we have a sensor co-located with our regulatory sensor in Phoenix as well. And so I can look this up now and look at real-time levels of the particulate matter in the spaces from the 6 sensors. And you can see things like when pickup time is, when the parents come, when diesel buses might be idling next to the school, and just general air pollution days, or when we had fireworks on the 4th of July, all these sensors pick that up. So it gives us a sense of what's happening directly within the space. And then we also have 6 of these microclimate monitors monitoring lots of different wavelengths of radiation that can tell us about heat exposure and the vegetative or not environment, as well as air temperature and relative humidity. And the last thing we're looking at is that continuum of health and well-being impacts. So a lot of those, the proportion of people affected by a lot of these impacts tend to be a lot closer to the bottom. And we know that we don't generally see kids of this age dying during heat waves or air pollution events, we see a lot of issues with going to the hospital or the emergency room or having asthma attacks and whatnot. So we're trying to collect more information on those, on issues of heat occurring at the playground itself or at the school, looking at the range of symptoms and trying to get what's in between that continuum where they're healthy or where they're going to the emergency room. So how much class time are they missing? How much recess are they missing? Does it affect their performance in class, their behavior, their mood? We're working with school nurses to try and figure that out. And we want to figure out how can we better monitor, measure, and understand the impacts to inform long-term policies and thinking about informal versus formal heat warning systems. And so with that, I will end with some of my funders and acknowledge them, and then my collaborators, and I apologize for the issues with my microphone. Hopefully that was clear, and thank you.
Thank you very much, Jenny. That's really impressive work, and it tees up very nicely what Hunter is going to talk about next.
Great, thank you, Chris. So we had two excellent presentations covering the hazard and how that's changing, and also some of the unique vulnerabilities experienced by one population of many that are of heightened vulnerability to extreme heat. So what I'd like to cover is, what can we do about this? So this talk will generally talk about the planning and preparing for extreme heat. And I also want to spend a little bit of time talking about two networks or systems that have been developed over the past few years that are intended to provide more resources and to bring together a lot of the efforts that are occurring right now to manage extreme heat. And one is called NIHIS, the National Integrated Heat Health Information System, and the other is called GIN, the Global Heat Health Information Network. And there we go. So I want to start with some hope. Heat-related illness and death are preventable. And there are actions that are available at all timescales that we can take to prevent these issues. So what I have here is basically an emergency management cycle, a typical representation of an emergency management cycle. And it begins with planning and mitigation, which can be done far in advance of any particular heat event, and then cycles through preparedness, which is how you prepare for a heat event when you're perhaps approaching heat season or in heat season and you see that one might be coming. And then also the response that you take during the actual event and then recovery from that event. And so there are actions that can be taken at all these timescales. In addition to this cycle, which might play out over a year, you can also plan into the future using scenarios and scenario-based planning using climate predictions. And you can also go backwards in time and look at how planning played out in the past as well. And two things that I want to cover that kind of play out on this time scale are heat action plans and heat early warning systems. You can see at the top the information that is available to inform actions at these timescales. So on the left is a climate projection from NOAA's Climate Explorer showing the change in the number of days per year with a maximum temperature over 90 Fahrenheit. So that's climate scale information that goes out many decades. In the middle, you can see a seasonal outlook from NOAA's Climate Prediction Center showing the increased likelihood of above normal temperatures in the southeast. And then on the right, you can see I didn't update the text there, but you can see an actual warning that was issued, warnings that were issued by NOAA for a heat wave that is either about to occur or in the process of happening. So heat action plans and heat early warning systems help us at these two timescales on the right, and usually a little bit less so at the timescale at the left. And that's just what this figure is representing below. Typically, a heat early warning system is how you respond to, and in some cases recover from, a heat event. And then heat health action plans are a little bit more general and often encompass a heat early warning system. And this is really just driving home that point. A heat action plan is a general framework for managing extreme heat in a municipality, a county, a state, or a nation. And they often include components such as the roles and responsibilities for managing heat health risks, specifications for a heat early warning system in a general sense, communication plans, real-time surveillance, and then often a component of a heat action plan that is really important is the heat early warning system. And the heat early warning system is really the nuts and bolts of how you determine what the threshold should be, when you alert and who you alert, what steps are taken, and what are the responsibilities for managing heat waves when they're occurring. Now, heat health action plans and heat early warning systems are a part of an ecosystem of other sorts of plans and policies that exist that might contain information about how you manage extreme heat. So I just want to make the point that we often talk in the discourse when we're just considering heat health, we often talk about heat action plans and early warning systems, but what's out there for us to consider is really also urban planning, all hazards plans, and climate action plans, and even policies in different organizations. All of these elements might contain references to what is done during a heat wave. And so when you're creating a heat health action plan and a heat early warning system, it's important to consider the other documents and other areas where you might want to influence policies and have connections. Now, I'm not going to go into all the details of how you might create a heat action plan or heat early warning system because those details already exist in a lot of literature. So I'd just like to point out some of the reports and other documents that could be used to help you create heat action plans and heat early warning systems. I would start with something like the 2018 National Climate Assessment that was issued last year, and the 2016 Climate and Health Assessment, both from the US Global Change Research Program. And these are more general documents that kind of give you a sense of what is happening with the hazard, how it's going to change in the future, and how it impacts health. And then there's also a guide from WMO and WHO on the right that provides guidance on warning system development. Additionally, there are guides that are even more recently released. Just this week, the Red Cross and a number of its partners released a heat wave guide for cities. I would encourage everybody to check that out. And USAID is a guide on heat waves and human health, and there's also a guide from the Commission on Environmental Cooperation on syndromic surveillance. And for those of you who are not familiar with that term, it's basically the observation system for health systems. So just as we would collect climate information or weather information using a variety of observation platforms, syndromic surveillance is how you collect health outcomes from reporting based on what happens in emergency rooms and other health systems. I now want to talk a little bit about the two other systems that I mentioned that are kind of being developed to help everybody find resources and to help both on a national and a global scale to manage heat risk. One on the national scale is NIHIS, the National Integrated Heat Health Information System. This has been under development for a number of years, and it really was started by NOAA and CDC in 2015, but has actually grown to incorporate a number of other agencies. NIHIS exists to basically identify what's already going on across the United States and with our partners in other countries, and to weave together all of the elements that are already functioning. So heat action plans that are already in place in other cities, research studies like the ones that you heard about earlier today. We're attempting to weave together these pieces and to do a better job integrating the response to managing extreme heat. So we do this in two ways principally. One is an interagency working group, which includes the agencies on the right. And that group basically helps all the federal agencies that help others manage extreme heat work together a little bit more effectively. One of the major outcomes of that group is creating a portal to contain all of our health guidance documents, climate guidance documents, weather guidance documents, basically everything that would be relevant from these agencies on managing extreme heat risk is assembled together in a portal now called the NIHIS portal, and I'll show you a picture of that a little bit later. We also have transboundary pilots that we're conducting with NIHIS, where we go into a community and we try to understand the local context of extreme heat and the health risks that are being experienced. Jenny mentioned that the extreme heat in the Southwest is arid, but there are other parts of the country that experience very humid heat waves. And so the way that you manage those might be different. So we're really trying to sample from different parts of the country to understand what we can do. This is just a representation of some of the places where we've done or plan to do engagements to understand the local context of extreme heat. We basically go into an area, often have a workshop, and we have some different approaches that we take to bring together a number of disciplines and to talk about planning for extreme heat. One of those approaches is a decision calendar, and I bring this up because it's actually going to be published in the next edition of the Bulletin of the American Meteorological Society. So look for this online. Understanding Decision Context to Improve Heat Health Information is the name of this paper. And it reflects one of these engagements that we had in the Northeast, where we developed decision calendars. I don't have a lot of time to go into the details on how these are developed, but essentially what they are is we bring together a number of people who respond to heat waves or who manage heat waves, who plan for heat waves, and we take them from consideration of an active heat wave backward in time all the way to long-term planning. And we talk about all the different decision points that different disciplines might have where they could use climate, weather, health information to improve their decision-making and to determine how they're going to protect people from extreme heat. So we have this process for documenting all those decisions, and then we work back to understand the requirements that we can bring to CDC, to NOAA and other agencies and other partners who are not in the federal government to help manage heat better. So the NIHIS portal I mentioned earlier, this is what it looks like. It actually will be changing in the future. We're working on a redesign, but you can visit it now and see a lot of the resources that I've mentioned or will mention right there. It's at climate.gov/NIHIS. Quickly to go through some of the resources that you might find there. We have story maps that we developed in cooperation with Esri that walk through different vulnerable populations and what can be done to protect them. So one example is outdoor workers, athletes, and others who are exposed and often exerting themselves outdoors. We have a story map that walks through what that issue is, actually uses some of OSHA's information in one of their databases to plot on a map where incidents have happened with extreme heat. So in this picture, you can see what happened to a roofing contractor. And also, we're working on developing better predictions of the wet bulb globe temperature index, which is a complex index that factors in a number of different variables, including temperature, insolation, wind speed, and humidity to determine how people who are active and outdoors can manage their risk better. Another thing that's available is a tool that was developed with Esri that combines CDC's Social Vulnerability Index with heat projections and allows you to actually zoom into counties and even the census tract level to see what the vulnerability is in various census tracts in various counties and what it's comprised of based on these 4 different components, and to compare that to heat projections. We also have experimental prototypes of tools that we're developing that don't really exist anywhere else. This is kind of a new type of information. In this one, we're showing what happened it's basically a weekly monitor that's looking backwards in time and showing a combination of the week's temperatures, average temperatures, as well as what's being reported in emergency rooms in terms of heat-related illness. So it's a good way to combine the health and the climate information or weather information. We're also conducting a number of urban heat island campaigns. This is actually extremely relevant right now. Last year, NOAA worked with some partners to run citizen science mapping, urban heat island mapping campaigns where we had citizen scientists driving around cities with temperature sensors. And with that information combined with satellite imagery and the machine learning process, we were able to develop maps of the urban heat islands that are high resolution and very accurate, and also very engaging because we used a citizen science process. So this is an example of the map that was developed in DC last year. We actually have these campaigns going on this year as well, and you can see the cities in red are where we're working this year, in addition to Hawaii, which is on the on this map, but it's been cropped off, unfortunately. So Honolulu is also getting an urban heat island campaign this summer. I should mention Boston is going live with their campaign this weekend, actually tomorrow. So there will be a little bit more information on how you can find out about that later. Really quickly, I want to cover the other really important network. This is not enough time to cover GIN, but the Global Heat Health Information Network takes a lot of what we're doing on the national scale that I mentioned with NIHIS and scales it up globally. So a lot of the same ideas apply. We're trying to bring together all of the global efforts to manage extreme heat risk and get people working together more effectively, and to make sure that learning is being shared across the globe with practitioners and researchers who are working on this issue more efficiently, so that we can have successes earlier on and hopefully prevent deaths and suffering. So this network really connects all those practitioners together. Our objectives are to improve the awareness of heat health risks, to catalyze and sustain these interdisciplinary partnerships that are essential to managing heat risk, synthesizing and advancing science and technology for decision making, improving access to expert resources, and identifying and promoting action to address critical gaps in research. The picture here is actually from our first forum on heat and health that happened in Hong Kong in December, and we are planning another one in Copenhagen for July 2020. I would encourage everybody who works in this space to investigate this. We're doing a number of things, including pulling together country profiles and creating a synthesis report on global action, and holding these global forums that I mentioned, as well as a learning exchange. Really quickly, I mentioned heat action planning before. We do have, on GIN, we have a repository of heat action plans that we know about so far. As you can see, the coverage is missing some areas, partially because some of these places don't have heat action plans, partially because we haven't been able to collect them all. But if you're interested in understanding how to create a heat action plan, I would encourage you to go to GIN and actually use this resource to find plans that already exist. We have an online learning center with a number of collaborators. I mentioned the second global forum on heat and health, which will be happening in Copenhagen. More information on that soon. If you go to the GIN website, gin.org, you can sign up for the mailing list and get updates. Really quickly, second to last slide, immediately after this, we are having a tweet chat. So climate.gov is running this on Twitter, and it's going to feature myself and also a number of heat health experts who are going to talk about how we manage extreme heat in cities, and particularly the urban heat island effect. So we have Patrick Kinney and Daniel Bader from CC-RUN in the Northeast, the Consortium for Climate Risk in the Urban Northeast, as well as Alicia Pagan from the Climate Ready Boston. She's the Climate Ready Boston coordinator. So if you want to join us on Twitter right after this to ask more questions, I would welcome that. And I will end with our conference that's coming up in 2020. It's the Centennial for AMS. It's the 11th Conference on Environment and Health, and abstract solicitation is still open. And so we have a number of excellent climate and health sessions, environmental health sessions that I would encourage everybody to take a look at and to submit abstracts to. And all the sessions are listed here, and they're due, the abstracts are due by August 1st if you'd like to participate in that January 2020 AMS meeting in Boston. Thank you.
So this is Jane Baldwin tuning in. Maybe while we wait for questions, I'll pose a question to Jenny and Hunter and Chris if she's around, which is, so we talked a little bit about heat wave warning systems. What are some examples of success stories versus challenges with these types of warning systems?
We do have questions coming in. So your first question is on some best practices.
Since I still have the screen, I could really quickly go back if I can get this to work. Chris, I might even punt a little bit of that question to you because I know you've written papers on exactly this. But I'll just start by saying on this screen, a best practice with heat early warning systems and heat action plans is to acknowledge that they're never going to be perfect, and there's always more that we can learn from heat events as they're happening, from kind of a hot wash process after a heat event has occurred. So these are kind of living documents that need to be updated every few years, based not only on your experience from heat events that are occurring, but also from reviewing future projections of climate and how the actual hazard might be changing, how vulnerability might be changing, whether the cities are urbanizing properly in a way that reduces the urban heat island effect. So essentially, I would say a key thing to remember with these plans and early warning systems is that they are living, and they have to reflect a learning as you go forward.
That's absolutely true, Hunter, and I'm going to tie that in with some of the questions that are coming in on the Q&A screen, is that a heat wave is contextual to a local population. That what we consider hot in Seattle is different than what Jenny would consider to be hot in Phoenix. And so you do need to understand the local temperature patterns, and you need to understand the vulnerability of the local population. There is evidence over time that in some places people are acclimatizing to higher temperatures, but we don't have evidence that people are acclimatizing to the very extreme temperatures we're now seeing as heat waves increase in frequency, intensity, and duration. No one needs to die in a heat wave. We know there's groups that are particularly vulnerable. Jenny was very articulate about the problems with children. We also know adults over the age of 65. And one area of interest that the panelists know I have is thinking about taking our heat wave early warning systems, which at the moment have one threshold for a region, and thinking about having steps of issuing a warning when the temperatures are not quite so hot for those who are particularly vulnerable, and then gradually increase the warning until it's at the point where everyone is at risk from a heat wave. We also heard very clearly from Jane that in terms of the current event, to pay attention that as the temperatures come down after a few days, if they rise again, that there may be increased vulnerability from this exposure to a compound heat wave. And so going back to you, Hunter, we do need to learn from each of these events, take the information we gather and help improve these events so that we do protect health in the short term. And as you clearly showed in the long term of thinking about how we plan our cities. We now have quite a lot of questions coming in. So a question is about the presentations. Yes, this is being recorded and will be made available at some point, Brandon?
Yeah, so we're in the process of pushing live an AMS webinars recording library. And that library is going to be available to AMS members and to board and committee members. But the recording file will also be made available to this board if you want to post it separately somewhere else as well.
Thank you. Okay, so there's some responses. Thank you to everyone who said that this was very interesting. We have a question to you, Jenny. Could you talk a little bit more about some of your results with children's exposure to PM 2.5?
Okay, I can attempt to. So far, we're just getting started with setting up those sensors. So we've been collecting data, baseline data in that space with those 6 sensors, but the intervention or the redesign doesn't start till the fall, and then afterwards we'll have more particulate matter data at the 1, 2.5, and 10 micron level. And one of the things we're looking at in those schools is, how often are kids using their inhalers? And that's tracked really well by the nurse. How often are they coming in with asthma attacks? That's some of the health information we've been tracking at that level. I've done work in the past on looking at doing like epidemiological. All right, sorry, I did it again. Doing epi studies looking at pollution exposure. But I think that with kids, they're such a small age group that they're often lumped into other age groups, and so it's really hard to really get a signal on what's happening for something like kids less than 7 years of age, and how exposures affect health outcomes. And so we're hoping to do, this is a long-term study that's kind of starting up at these play spaces, and we're hoping then I'll have a better question or answer to this question in 2 or 3 years with respect to the connections between PM exposure and health at that specific scale. I think there's lots of good citywide studies done looking at this as well. But generally, we understand the health impacts of particulate matter exposure on people's lungs. And in that region of South Phoenix, the asthma rates in kids is very high. And it's one of the reasons we're doing the work there.
Oh, thank you. We've got 2 questions on the compound heat waves, and I'll try to combine those. Very high interest in the issue of compound heat waves, Jane, and so this is actually to all of the panelists, is better dissemination of the challenges of compound heat waves, increasing people's understanding, can be used to increase overall resilience as the climate continues to change. And so specifically for Jenny and for Hunter, of thinking about how to incorporate that into, Jenny, the work that you're doing, and Hunter into the heat action plans you talked about.
So I think that, like, after listening to Jane and the work I do, I think that we can start looking at that at the microclimate level within the urban areas to see how it's impacting health. And so as we're working with other school districts and the nurses, we can start to try and connect the health outcomes they're recording in their nurse's office with heat waves, and then also add into the analysis compounding heat waves, and of course looking at what a heat wave means for Phoenix, which will be very different than other, like the northeast of the country, because we get 100 days over 100 here, and so we can't just keep kids indoors all the time. We have to find ways to create cooler outdoor spaces and shadier outdoor spaces.
Can I jump in and say one thing? Chris, this is Jane here.
Sure.
Yeah, I think, so I've spent some time this year trying to dig into the epidemiological literature, which admittedly is not what I'm really trained in. So I've been trying to work with some epidemiologists to try to better understand if there's evidence of this kind of like non-linear addition of multiple heat waves in sequence. So basically, if an initial heat wave kind of primes people such that then they're more vulnerable to a subsequent heat wave. And it's actually a pretty challenging problem, partially because of some things that were first brought to my attention through interacting with the Board of Environment and Health, which is a bit of a shout out to how great this board is and its interdisciplinariness. But basically there are issues where, an initial heat wave, the vulnerable people might perish such that in a subsequent heat wave, you might see lower mortality, but is that actually reflecting the risk? So anyway, I guess what I'm trying to say is I think to be able to incorporate this thinking about compound heat waves really concretely into these heat wave warning systems, we do need more work to try to see in what ways does compounding of heat waves actually affect impacts and risk in a more tangible way. My presentation was kind of just focused on the climate data, but really connecting that with the health data is still an important thing to do.
And this is Hunter.
I'd like to add to that. Oh, go ahead,
Sorry.
Hunter.
Oh, I was just going to to add. I'm actually going to combine my response to this question, and also there was a response or a question a little bit further down on educating the public on wet bulb globe temperature, and what I would say is first of all, kind of reflecting what's been said before. This would have to be, we'd have to analyze exactly what the health implications are of compounded days, compounded heat waves, and there is, I think we do have to be sensitive to. I guess I would say crying wolf, how the public actually understands and interprets compound heat wave days. There's also a psychological effect and kind of a mental health concern with messaging that, heat waves are getting so bad that we're going to have an epic heat wave that lasts 10 days if you add on the compound days or something like that, which isn't to say that shouldn't be expressed and shared, but we have to think about the right way to send those messages to elicit the response that we want. And then bringing wet bulb globe temperature into this, metrics like that are complicated to explain, and there's an argument that using something a little bit simpler when we're expressing the risk to the public is probably better. And something like wet bulb globe temperature, and in some respects, consideration of compound days, might be more appropriate for certain subpopulations and certain decision-making groups, certain decision makers like public health experts, epidemiologists, who are able to process that information a little bit differently and able to take more action based on it. So all of these different consideration, all these different indices and different ways of understanding heat waves and thresholds, they might have different applications for different groups.
That's great. And another point that was raised is how our thresholds will change over time. And thinking in terms of the thresholds we've got now, we've got like 90th percentile, 95th percentile in various regions. And as temperatures continue to rise, we need to think, as I said earlier, both about how people they will continue to acclimatize to the increase in the mean temperature to some degree. There's questions to the extent to which humans can actually acclimatize to the very high extremes we're seeing in some of the heat waves around the world. There's a related question about minimum temperature, and all of the literature talks about how if temperatures don't go down at night, that it increases the heat stress on our body. And what's going to be happening in terms of incorporating minimum temperature into heat action plans as we start seeing more warm nights and then extremely warm days. Because we're moving outside of the range of temperatures that we have data for in a particular region, it is a challenge to directly answer those questions. People use analog cities, but a problem with using an analog city with higher temperatures is often the infrastructure is quite different. Access to air conditioning, for example, is different. So it is an area of active research. And I would like to hear from the panelists on if there's other issues that you would like to raise around minimum temperatures and evolving thresholds over time.
So Jane here, I guess one thing, I was actually typing this out, so I'll just say it quickly, is so in my study, I use the same threshold in looking at the present climate and the future climate. So basically, I'm framing it as the adaptation challenge in the study. I did partially because I wanted to try to make the information, kind of put it out there so then people who know more about the human response than me could look at it. However, it's important to note that that is almost certainly not what's going to happen in the future, because there's a lot of evidence that people do and have adapted to heat waves in the past by using air conditioning more or behavioral change, which I'm sure other panelists here know more about. So I think it's an important uncertainty in doing these heat wave calculations is what should you do with the threshold. And where it stands now is it seems like people either make the assumption of no adaptation like I did, or sometimes they take a step further and say, well, what if we assume some degree of adaptation, use kind of the intermediate threshold, or what if we assume perfect adaptation? It would be interesting to get feedback on whether that's actually useful for people who are dealing more practically with these issues than me.
Excellent point. And then I see one last question around active transport. The question focuses on the difference between humid heat and arid heat. In the end, heat is heat, and at some point, even arid heat becomes too hot. And how to think about this design of our cities as temperatures continue to rise and as we're trying to increase the number of people who walk and bike to reduce our greenhouse gas emissions, and thinking about how to manage that design in a changing climate. Would anybody like to make a comment about that?
This is Jenny. I can comment quickly. We have quite a few studies going on within the Phoenix and Tempe area on active transport, and focusing on bus stops or the routes that people are taking to get to the bus stops or the train stops and whatnot, so that they're comfortable. And so even with our plan to increase tree canopy, we're focusing on these routes that people are taking that we know, or maybe what are the areas where people are, like where's the highest ridership in the city, and then trying to focus a lot of our shading efforts on those areas. We even have a bus stop here that has misters on it, which work really well in a dry climate, wouldn't work well in a humid climate. And so that's some of the stuff we consider. It's not really a one-size-fits-all problem, but it's looking at the local context of kind of the who, what, where, and kind of the what type of heat are you dealing with. And definitely different here than in the Northeast, for example.
Well, with that, I really want to, go ahead, Hunter.
No, I was just going to say that Jenny did a good job answering that, so I didn't want to add anything. So thank you.
And with that, I want to really thank our panelists who did an outstanding job. I want to thank all of you who joined. And I want to thank AMS for sponsoring this webinar. And we look forward to hopefully seeing many of you at